Hello, everyone. Welcome to Health 180 with Carion Fenn and Rogers TV. In Canada, approximately 60,000 out of hospital cardiac arrest occurs each year. With a survival rate of only about 10%, bystander CPR rate varies across the country, ranging from 42% to 72%, and the use of AEDs in public setting is low, at only 13%, according to the Heart and Stroke Foundation of Canada. Today, I'm joined by Tony and Jacob Romano at TRTC Consultant to talk about what you should know about CPR. We want to help you learn more, so let's learn together. Tony, welcome back to the show, and Jacob, welcome to our show.
Thank you for having me.
Awesome being back.
Awesome to have you guys join us. Tony, tell us about your organization and why is it important to you to ensure that members of the public are aware of the importance of knowing CPR?
Thank you, Carion. Simply put, we provide a lot of different medical training, specifically CPR or first aid training or emergency first aid training to all different levels of audiences, whether it's individuals or young people that are looking to enter a career into police, fire, ambulance, or any profession or education requirement that requires first aid or CPR, as well as we look after dental clinics, a lot of nurses who need their recertification, and many members across this community just for the sake of taking CPR and first aid because they want to make a difference in our community.
Yes.
And to your question, why it's so important, to your point, emergencies can happen anywhere, whether it's in the home, whether it's on the way to work or at the workplace. We just don't have an idea or a prediction of when and where it's going to happen. So we want to make sure we collectively are prepared to respond to anything that may happen in front of us.
Mm-hmm, mm-hmm. Yeah, that's so important. I think sometimes we take that a little bit lightly in terms of the importance of having that certification. Jacob, we see so many young people out there. We were honored to have or take part in your organization actually certified in the youths in our Alex Monahan Youth Program. And to you, coming from a young person's perspective, why do you think that CPR is important to know?
Yes, thank you for the question. It's so important to know, and as my dad was talking about, you never know when a situation like this might happen. It could happen anywhere. And it's so important to know CPR to preserve and to revive anybody who might be going through cardiac arrest, and to prevent stuff like brain death. So it's important to learn CPR, know it so that you can preserve life and ultimately, hopefully, save a life.
Yes, yes, and that's so crucial. I'm always intrigued because I have a parent young person team with my foundation, and I appreciated seeing you and your dad, the Romanos, and we have the Fenns. It's amazing when we can pass down what we know to our children and just watch them blossom and grow. So I'm just taking a moment to just appreciate the Romanos joining us on Health 180.
We're a busy family, just so you know, but we need a point
yes. It's a proud moment. It's a proud moment because, speaking of which, as we are having this conversation, you and your son, my son was trained by Rogers. He's behind the scenes. So, passing on our skills and talents and, the hard work and dedication to the next generation. So just taking one for a proud moment. You and I can be both proud parents, Tony.
Absolutely.
Yes. So, Tony, what does the abbreviation CPR means?
Great question, Carion. And you'd be surprised how many people have taken CPR over many, many years. When I ask that question at a training session, they don't know. And so CPR involves two components. It's the heart, cardio, and the lungs, which is pulmonary. So those are the two organs that we as CPR providers are going to focus on. The compressions is we're providing, essentially when we're doing compressions, the person who needs CPR, essentially their heart is stopped. And what we're doing is we're providing that artificial heartbeat for them. And as the heart is stopped, they are no longer breathing. So we are now providing the rescue breathing or the ventilations for them. So it incorporates the heart and the lungs in hopes of keeping that brain alive. And we know that there's a magic number that is, I think it's 4 to 6 minutes, Jacob, that anything beyond that, you're going to start having irreversible brain death. So we want to mitigate that and get our hands onto the chest and provide aggressive compressions and ventilations in hopes of at least pausing the irreversible brain death.
Jacob, can you tell us, where do you place your hands for CPR compression?
Yeah, so when you're doing compressions, you want to place both of your hands, one on top of another, on the lower sternum or around the breastbone area, the lower breastbone area.
Okay. Tony, we talked about, a lot of us spend a lot of time at home or even in the office, and we don't worry about these things or consider these things might happen in scenarios that are around us. How often is a heart attack that happens at home, is that a popular thing, or how often do you think that actually happen or people are in that scenario at home?
I don't have the hard numbers on that, but what I can tell you, emergencies do happen at home. And when we take this course, a lot of people take the course because they say my employer or my educational institution wants me to take it. However, at the workplace, if something happens, generally speaking, there are a few sets of hands that will help. Usually, if it happens at home, you may be the only person that can render any kind of assistance to perhaps, a mother, a father, grandparent. So it could be any type of emergency. It could be a seizure. It could be like a heart attack, a stroke, anything like that. So we just want to be prepared when that happens at home.
Okay. Jacob, what is the first rule of CPR?
The first rule of CPR is to take a look at your environment and call for help. There are situations where it might not be safe to run to an individual right away, depending on where you are and what your situation is. However, you want to examine your environment and then you want to call for help. That could be yourself calling 911 or directing bystanders to call 911 as you attend to the person.
So, Tony, can you explain to us what is the 3 C's in CPR?
So that's some of that is passe in the sense that we don't really use the 3 C's anymore. But we want to make sure our approach is, as Jacob said, we want to make sure the scene is safe. We approach a patient with verbal stimulus, a physical stimulus, and then we check for a pulse. And if in the absence of all those things, then we do CPR. Now, if a pulse is present, but there's no breathing, then we do rescue breathing. But in the absence of no breathing and no CPR, we want to make it very clear to people that we want to start CPR right away.
Okay. Jacob, when performing CPR, what is the ratio of chest compressions to breaths?
Yes, so when you're performing CPR, the number is 30 compressions to 2 breaths, or 15 to 1. And that's for both adults and pediatrics or infants.
Okay.
So let me
Tony,
qualify there. It's 30 compressions and then 2 ventilations for adults. So for instance, even if it's a 2-person rescuer, it still is 30 compressions to 2 ventilations.
Okay, awesome. So, Tony, when is the right time to stop CPR once you've started the process?
The right time, hopefully, is when that person starts to breathe and starts talking. And I can tell in my experience, I've been fortunate enough to see a few of those instances happen. And I think many of us know within our circle of friends that these feel-good moments do happen. So
Yeah.
when would you stop is if you have a pulse, especially when you have a pulse. And if they're not breathing, it's okay. We're going to do the rescue breathing. Or perhaps the first responders show, emergency services. However, what I can tell your viewers is if you're doing quality CPR, quality compressions, the paramedics may say to you, hey, Karen, you're doing a fantastic job. Do keep doing what you're doing, and we're going to work around you and look put the cardiac monitor on. They may start an IV and give medication. So to your viewers, just because they show up, keep doing quality compressions because you are now an extra set of hands that is vital to the role.
Okay, awesome. What is the purpose of AED, Tony?
I'll tell you, it's a game changer. I think it's been a few years now, and an AED, we will all agree, we can find them at most of our workplaces, any town, municipal, regional facilities, city facilities, and essentially it has changed. It has changed the game. And what the AED does is it's automated external defibrillator. It is specific to a lethal heart rhythm. So not to get too high level here, but the defibrillator is quote unquote trying to jumpstart the heart back into a normal rhythm.
So, Tony, can you tell us what is one tip you can give to someone who's considering taking a CPR course but not sure where to begin?
I mean, the internet has everything. It's a fantastic tool, fantastic resource. And even at the moment, if you're not sure of when you can take it, just Google CPR, Google the, what the steps are. But if I can say this is more of a public service announcement, in my career as both a paramedic and a police officer, many times I've gone to situations where a member of a family has said to me, I wish I would have taken CPR. And it is heartbreaking. So anybody who has that inclination, don't wait to take it because you need it for work or perhaps your education. Take the course. It is, whether it's through Heart and Stroke, St. John's, Red Cross, it doesn't matter. Take the course.
Just take the course. That is so important. You're watching Health 180 with Carion Fenn on Rogers TV. We are exploring CPR with Tony and Jacob Romano at TRTC Consultant. My name is Carion Fenn, and we'll be right back.
CPR. This thing now runs the show until first responders come, or until it got good shuts off. But after 2 minutes, it will say stop CPR, analyzing, shock advised and no shock advised. But we're going to follow this prompt.
Welcome back to Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. Report shows that nearly half of all cardiac arrest happens to people under the age of 65. We are exploring CPR with Tony and Jacob Romano from TRTC Consultants. Tony, can you tell me what are the 3 Ps in CPR?
So again, that's another acronym that has kind of gone by the wayside, and I teach under the Heart and Stroke Foundation.
Yeah.
But what we want to make sure is we want to make sure that like I said to your viewers earlier, what is so important when it comes to it's a very, very simple skill in the sense that as long as it's safe for us to approach, and we have determined that the person is not responsive and there's no pulse, we want to make sure that we go hands-on right away. And as well as making that call to 911 so we can expedite the response of the emergency services.
Okay. Jacob, statistics shows that 18% of citizens in Canada know CPR. That's a little bit low. I was actually expecting more than that. Why do you think the number is so low?
That's a good question, and frankly, I don't exactly know. And you know,
Yeah.
growing up and going through high school, I know they're starting to teach it in grade 9, which is I believe it's in grade 9, maybe grade 10, which is a great start to ultimately teaching the youth. However, it could be lack of opportunity and education around how life-saving CPR really is, and it may be lacking in places such as the workplace and such. So ultimately, I don't have a concrete answer for you, but I do believe that we are trending towards more education around the topic.
Yes, and that you're right about that, because that is something that we incorporated into our program for youths that you guys were so effective in. And I want to bring this up early so that we can touch on it. Many of you know that are watching, I take care of the homeless in the town of Ajax, and it's a passion of love that I care about. I consider them all my family, and following, like, within a week of doing the CPR with you guys, I was doing one of my regular taking warm food to the homeless, and just as I handed food to one of the individual, he walked away from me and he collapsed. And my first initial response was panic. But then I didn't panic, right? I didn't panic. But then we all like jump into gear at that point. And one of the things that came in handy was that there have been individuals who in that scenario, but the individual around the area, they did not know CPR. And one of the response that I heard was the person who ended up doing the compression for myself. I was able to instruct everyone in regards to what to do to participate. In that scenario, we needed Narcan. And one of the things that I heard was that the person who did the compression who meant good and all that stuff, right? He actually broke someone else's ribs in past experiences. So taking what I learned from you guys, I was able to and I did not know this before, to be honest with you. And had I not participated in this process, I think I would have absolutely panicked, right? So I was able to go through the processes of, someone, go get help, call 911, like all the different steps that were taught. And what was impressive for me was that everything that you taught me, like, just automatically just snap into force, And even when I did have someone who went to knock at the shelter door to ask for Narcan, but when the person wasn't able to do so, and I had to go knock, but when I went to knock, I got the Narcan, and we were able to save that person's lives. But I think, and I was considering too, because for myself, being a person with a disability, at first I was thinking to myself, because of my injury, maybe I shouldn't have